So today I'm going to talk to you a little bit about allergies, and there's so many misconceptions and misinformation out there, and people who want to sell you all kinds of things that are going to cure the allergies, but I'm going to kind of give you just a basic picture of what's important to know. And most importantly, remember, every dog is different, every situation is different, and you really need the help and guidance of a veterinarian to choose the best products. But most people come to us because their dog is, say, itching for whatever reason, and obviously the first thing we're going to rule out would be parasites. There are certain kind of mites that can cause itching, but certainly fleas and even ticks can cause itching. So we're going to make sure that those things are well covered first. And then the next thing we're going to start to talk about would be things like environmental concerns. But really with allergies, the way that they work with most dogs is that the vast majority are contact allergies. Yes, like something like that. And a dog is going to be exposed by stepping or rolling or laying in the grass or whatever, and they're going to be exposed to allergens. And when we test for allergies, we're testing for about 75 different things. So no one can look at your dog and say, oh, it's grass. There's just really no way of knowing that. But it's certainly a very good possibility that it could be grass or molds that are in the grass when the grasses are wet. But what happens is these allergens are exposed to the dog's skin, and then they're absorbed through the skin. And dogs that have allergies, a lot of them have a barrier problem. So that meaning, if you think about the skin as being like a saran wrap, and dogs that have allergies have like more holes in their saran wrap than other dogs. And so then these allergens are able to penetrate through the skin, and in addition, they have sort of an overreaction to whatever it is they're being exposed to. So if it's grass, the grass allergens are getting into the skin and into the second layer of the skin a little bit easier, and then the body may be overreacting, causing histamine release and other things that are really itchy for the dog, and then it's going to cause the dog to itch. Once the dog starts licking and chewing and scratching and biting, we're going to get secondary problems like yeast and bacteria infections, which may require us to do some cytologies. Basically, we're looking at the cells of the skin to see if there's yeast or bacteria, because they're treated very differently. We have so many amazing drugs now to help fight with allergies. We have two new medications. One is a pill that is a non-steroidal pill that really helps to block actually the reaction of itch. And another one is an injectable drug that also helps with the over-response that an allergic dog displays. And these drugs are amazing and such a lifesaver for a dog's quality of life. But they do require that we make sure that infections are cleared up and that we've done a pretty thorough workup before using any of these medications. So bottom line is this: most allergies are contact allergies. There are definitely a percentage of dogs that have food allergies also. Some of them can have a combination of all the above. But I think if you went into a pet store, you'd find they're quite often telling you have to buy this certain kind of food, and really rarely is that what should happen. You don't really want to get your health information from a 16-year-old pet store employee. Not that there's anything wrong with them, but they don't generally have the 8 years of school that help us to make a better plan for your puppy or your dog in choosing the best medications. So if your dog's having an itching, scratching problem, most importantly, just get to the vet, have them start working your dog up, and find the best way to get your dog skin under control.